welcome back to my channel. My name is Zumi and I'm a pediatric resident in Istanbul, Turkey, and this channel is all about doing medical residency and medical career in Turkey for international medical graduates. This video is going to be a little bit different because I will be addressing the medical students out there. So if you want to know what I'm going to talk about in this video, as I have done, I've taken my cup of cocoa, and you can take your cup of coffees and your popcorns and join me to the video so that you can learn and see what I've prepared for you in this video. So without further ado, let's get into the video. I'm going to talk about how to choose a specialty. I'm not a pro on this matter, and I don't know if there will be anyone who will be a pro on this matter, but sorry, I'll just try to share my story with you guys on how I got to come and choose pediatrics above all those other specialties, and and so on and so forth. So as you know, I'm a pediatric resident, so for me it was a little bit confusing at first, that I was not sure like if I wanted to be a pediatrician or not. But one thing I knew was I wanted to be a clinician. So when I take a stethoscope, I use it, I feel like now I'm doing something, like I am me, this is who I am. I want to be a clinician. So another thing that I asked myself, do you want to take care of older people, or can you take care of younger kids? Like, are you that patient to take care of younger kids? And that question was like, am I that patient? I'm not so sure, but do I want to take care of all the patients? That was a no. So I moved to pediatrics more. So you, as yourselves, you can decide whether you want to be a surgeon, or you want to be a clinician, or you just want to be a basic medical person, like anatomist, biochemist, and microbiologist, and so on and so forth. If you're like, I don't want to stay a patient, but I still want to be in a medical field, so things like the basic medical departments like microbiology, anatomy, biochemistry, and so on and so forth will be a proper choice for you guys. But like me, if you want to be a clinician, then you have to come to the clinical side of the of the topic. So you also have to see yourself, like, what do I like, what do I not like. Like people who want to become surgeons, you will not or never change their minds, because they already have that in their minds, that I want to be a surgeon. It doesn't matter which surgery department it is. Some of them will be like, it doesn't matter, I just want to be a surgeon. So for me it was like a no, because I'm a chronic anemic person, so I'll get tired all the time. I'm all the time fatigued. So I'm like, no, I'm not gonna stand on them 5, 6, 7 hours surgery and do stuff when I can, like, my body is not like compatible for that. So I was like, it's a no. And then I also torn between pediatrics and anesthesia. Actually, on my choices, the choices that I've made when I've done my examination was only between pediatrics and anesthesia. But the anesthesia thing was like, okay, I want it, but am I going to focus more on being a clinician, or am I just going to be in the surgery room and like sedate the patient and anesthetize the patient or anything like that? So I was like, okay, which one do I want more? Which one can I favor? Like, do I favor more? So for me, it was pediatrics. So I ended up picking pediatrics, and now I'm a pediatrician. So when I come back to you guys, if you want to choose a specialty, this is a big mistake that people make. Some people like, I want something very smooth, something very easy, something that doesn't have any tension or anything like that. Yeah, there are some specialties which are like that. Maybe you can go to dermatology, you can go to radiology. Those departments, they're like, you don't have any adrenaline, like everything is so smooth, it's so easy and all of that. But if you like adrenaline, I guess I like adrenaline, because for us to be like arrest or cardiac arrest, respiratory arrest or anything, anaphylaxis cases are a lot for us. So we're all the time in an adrenalinic state of mind whenever we are in the hospitals, and we work a lot of hours. So if you don't want to work a lot of hours, you can also decide to pick other specialties. If you like surgery, as I say, there are like urology, gynecology, those departments all involve surgery, and like a general surgery, and we also if you like minor surgery, like I like surgery but I don't want to be onto too much of a big surgery and all that, you can go to like ENT or ophthalmologist and so on and so forth. So you first have to check yourself, check your mental health, check your physical health. What can I cope with? What can be easy for me? What can I like endure? Like, because maybe like basic medicine or dermatology can be very smooth throughout, but all other departments, they're not going to be very smooth throughout. They will have some up and lows, so you have to endure some stuff. So you have to ask yourself, what can I endure? Like, can I endure working a lot of hours despite the fact that I mean I like this thing, but can I endure that? If you can, yeah, okay. Like for me, I stepped back from the surgery departments because I knew like my physical health, my physical state was not compatible and I wasn't going to endure that type of thing. And I also stepped back from the like anesthesia, radiology and all those things because I wanted to be a clinician. I wanted to look, to examine and to take care of a patient on a one-to-one level. Okay, so those departments wouldn't give me that satisfaction if I went on to those departments. So for you guys, you have to think of that. And also the money part is also important. Some departments can, when even if you are a specialist, you will gain and earn a lot of money, and some will not. Like nowadays, the plastic surgery, dermatology and those cosmetic departments, things, they have a lot of money. The neurosurgery and general surgeries also have a lot of money. So if you also want to earn more, you can also deal like that. It can help you to decide on what you want and to deal with and not. So those are three things: what you really like, your passion, what you can endure physical wise, mental wise, and that thing. And also, what about the money? Like which department can give you the money satisfaction that you want? Those are the things that you have to consider when picking a specialty. So, and that's all I wanted to talk about to the medical students who are like, they're asking themselves like, why am I gonna choose, or why should I choose, or what can I choose, and all that. So until my next video, thank you and bye bye. So, and don't forget to drink your cocoa.